Hi, everyone. My name's Melissa Maranzano, and I'm honored to be here and sharing with you today. As someone who has spent over 20 years working in nonprofit and mental health, I've dedicated my career to supporting children, families, and communities by working to improve systems, advocating on behalf of families, and providing empowering education and training. As a parent myself, I understand how overwhelming it can be when a child is struggling, and I'm here to provide some guidance through this journey. Tonight, we'll be discussing a topic that is both urgent and deeply personal: understanding when and how to seek mental health support for your child. The goal of this presentation is to equip you with knowledge, resources, and confidence to navigate services and ensure proper support for your child. We'll start by looking at mental health trends among youth, including the impact of social media, academic pressure, and the lasting effects of the pandemic. Then we'll break down the different levels of mental health care, from outpatient therapy to intensive programs and inpatient care, so you can better understand what options are available and what might be right for your child. Most importantly, we'll talk about how to have meaningful conversations with your child about their emotions, how to recognize warning signs, and how to advocate for their needs in schools and communities. I encourage you to ask questions, share your thoughts, and engage in this conversation because as parents, we're not alone in this. By coming together, we can better support our children's mental well-being and create a strong foundation for their future. Thank you for being here. Let's get started. Before we dive into the details of mental health care options, let's take a moment to understand the current landscape of youth mental health, both nationally and here in New Jersey. The reality is that more children and teens are struggling with anxiety and depression and other mental health challenges than ever before. And as parents, it can feel overwhelming to know how to help. Let's start with some important numbers. Mental health struggles among youth are not just increasing, they are reaching crisis levels. According to recent reports from the CDC and the New Jersey Department of Health, nearly 1 in 3 adolescents in New Jersey report feeling consistently sad or hopeless. This is a 40% increase over the past decade. Suicide is now the second leading cause of death for adolescents and young adults. In New Jersey, youth emergency room visits for suicidal ideation have doubled in recent years. Despite these numbers, nearly 60% of youth with depression do not receive mental health treatment. Barriers include stigma, lack of resources, and long wait times for services. So what's behind these rising numbers? There isn't just one reason. Rather, it's a combination of societal, academic, and family-related stressors that are taking a toll on our children's mental well-being. While social media can be a great way to connect, it also exposes kids to comparison culture, cyberbullying, and unrealistic beauty and success standards. Studies show a direct link between excessive social media use and increased rates of anxiety and depression in teens. There's also the pressure to succeed academically. Getting into top colleges and balancing extracurricular activities is higher than ever. Many kids feel they have no room for failure, leading to burnout and self-doubt. Family and environmental stress is a factor, whether it's financial instability, divorce, or a lack of open communication. Family stress can significantly impact a child's emotional well-being. Some kids also take on adult responsibilities, caring for younger siblings, working, or helping manage household stress, which adds another layer of pressure. And of course, we can't talk about youth mental health without acknowledging the lasting impact of COVID-19. While the worst of the pandemic is behind us, its effects on mental health are still very real. Kids missed out on critical social development. Many still struggle with anxiety in social settings, difficulty making connections, and feelings of isolation. Remote learning was difficult for many students, and now some feel behind or inadequate compared to their peers. Lockdowns brought economic stress, loss, and heightened tensions at home, leading to increased anxiety and depressive symptoms in children and teens. So, what does this mean for us as parents? It means we need to be more aware than ever of the signs of mental health struggles in our kids. It means we need to create open lines of communication, reduce the stigma around asking for help, and seek support when it's needed. The good news is that, as overwhelming as these statistics are, early intervention and the right support can truly make a difference. Next, we'll discuss the different levels of mental health care and how to determine what's right for your child. Now that we've explored the rising mental health challenges among youth, the big question becomes, what can we do? How do we know when our child needs more than just a conversation at home? And what type of care is the right fit? Many parents struggle with understanding the different levels of mental health care. It can feel overwhelming, but my goal is to break it down into clear, manageable steps so that you can confidently seek the right support for your child. So the first step in mental health care is outpatient therapy, first line of support. For many kids, this is appropriate and the perfect first step in mental health treatment. This is what most people think of when they hear of therapy. Regular sessions with a licensed professional that help you talk through emotions, develop coping strategies, and work on personal growth. Outpatient therapy can include different things. So it could be individual therapy where there's a one-on-one approach between a therapist and a child, and they process feelings, manage anxiety or depression, and develop healthy coping skills. Another option is group therapy, where small groups of peers who face similar challenges come together in a structured setting led by a therapist. And this can be incredibly helpful for social skills and emotional validation. Family therapy can also be very useful. Sometimes the best way to help a child is by strengthening the communication and support within the family unit. Family therapy can help parents and children work together on navigating challenges. So, what type of kids are benefiting from just outpatient therapy? This is a child who is experiencing mild to moderate anxiety, depression, or behavioral issues. It's a child who is in school, social life, and family dynamics, but needs extra support. It applies coping strategies outside of therapy. However, for some children, once a week therapy isn't enough. They need more frequent support to manage their emotions and behaviors effectively. That's where more intensive options come in. So the next IOPs. An intensive outpatient program is designed for youth who need a higher level of care than traditional outpatient, but don't require full-time hospitalization. IOP provides structured, intensive therapy multiple times a week, giving kids and teens more opportunities to build coping skills and emotional regulation. So what does IOP look like? Kids generally come to IOP 3 days a week for a few hours each time, and they bring emotional resilience, distress tolerance, and healthy coping mechanisms. Attending school while receiving more intensive treatment. So what kids are benefiting from IOP? So generally, it's a child who is struggling with daily functioning due to anxiety, depression, self-harm, or other emotional difficulties. It is someone who's tried outpatient therapy but needs more structured support, and or a child who is with professionals but can still remain at home and in school. IOP is a great option for kids who are struggling but don't need around-the-clock supervision. However, some kids still need more intensive support. And that brings us to the next level of care, which is partial hospitalization program, or PHP. So a PHP is the next level of care for youth who need more structure and support than IOP. How is it different from IOP? Well, PHP is more intensive. They often come 5 days a week program, and they come from roughly, depending on the program, 9 to 3. It's designed for kids who are struggling to function in their daily lives due to severe anxiety, depression, or behavioral issues. It provides a structured therapeutic environment during the day while allowing the child to return home in the evenings. So who benefits from PHP? It's a child who can't manage daily life or school due to mental health struggles. It is someone who needs consistent support to prevent hospitalization. It is a child who has recently, PHP is really providing intensive therapy in a safe, structured setting and helping children stabilize before transitioning to IOP and then outpatient therapy. And then we have the most intensive level of care, which is inpatient hospitalization or residential treatment. These options are for youth experiencing a mental health crisis, where their safety or the safety of others is at risk. What is inpatient treatment? So that is a short-term stay in a hospital setting. It's designed to stabilize. It provides 24/7 care and supervision by mental health professionals. It focuses on immediate crisis management, medication stabilization, and safety planning. And residential treatment is a longer-term live-in program designed for youth who need ongoing structured care. It provides comprehensive therapy, education, and skill building in a highly supervised setting. It helps children transition back to daily life after intensive treatment. So who needs inpatient or residential treatment? It would be a child who is in immediate danger due to suicidal thoughts, self-harm, or psychosis. It's someone who has not responded to outpatient, and it's a youth who needs around-the-clock supervision and intensive therapy to stabilize. Understanding these different levels of care is key to finding the right support for your child. Mental health treatment is not one size fits all, and each child's needs are unique. Some benefit from weekly outpatient therapy, while others may need a structured IOP or PHP to regain stability. And in crisis situations, inpatient care may be the safest option. As parents, our job is to recognize when our child is struggling, seek the right level of support, and advocate for their needs. The good news is that there are many resources available, and with the right care, children and teens can build resilience and thrive. Next, we'll talk about how recognizing the warning signs that your child needs professional support and start that conversation with them. As parents, one of the most important things we can do for our children's mental health is to create a safe space where they feel comfortable talking to us about their emotions and struggles. But that's often easier said than done. Many parents will say things like, my child shuts down when I ask about their feelings, or I don't want to say the wrong thing and make it worse. While these concerns are completely understandable and valid, the good news is that there are simple, effective ways to approach these conversations that can help your child feel heard and supported. So one is creating a safe and open environment for discussions. The first step is making sure your child knows that talking about emotions is safe, normal, and welcome in your home. Many kids don't open up because they're afraid of being judged, punished, or dismissed. So we need to show them that their feelings matter. We need to model emotional openness as well. If you talk about your own emotions in a healthy way, your child is more likely to do the same. So, for example, you can say to your child, I had a tough day at work today and I'm feeling frustrated. I'm going to take few deep breaths to calm down. Let them know how you're feeling. So we also want to choose the right time and place. Kids open up when they feel comfortable. So try casual settings like driving. We also want to avoid overreacting. So if your child does share something difficult, stay calm and listen. If we panic, if we get angry, or immediately try to fix the problem, they may shut down. So instead, try saying, that sounds really hard. I appreciate you telling me, things like that. And use age-appropriate language to express emotions. Young children, tweens, and teens all express their emotions differently. So our job as parents is to help put words to what they're feeling. So for younger children, like 4 to 10 roughly, use simple emotion words: happy, sad, angry, worried. You can try emotion charts or feeling faces to help them identify what they're experiencing. You can Google those things and find them online. You can also read books about emotion and conversation starters. And ask guided questions like, I see you're clenching your fists. Are you feeling frustrated? Put those words together for them. And then for teens, we're going to validate their emotions, even if they don't make sense to you. Say, I can tell this is really important to you. What's been on your mind the most lately is a good starter. And then use media as a conversation starter. A song, a TV show, a TikTok video. Those can spark meaningful talk about emotions. And if they don't want to talk, try writing. A text message, journal, or a note can sometimes feel easier than face-to-face conversations. And we want to encourage active listening and validation. So often when kids do open up, our instinct is to offer solutions. Here's what you should do. But before problem solving, they need to feel heard. So active listening means a few different things. It means making eye contact and putting distractions away and telling them what you're doing. Say, I want to hear you. Let me put my phone down and be clear about it. Reflecting back what they say. Say something along the lines of, it sounds like you're really stressed about school. Avoiding dismissive phrases like, you'll get over it, or that's not a big deal. And asking open-ended questions. We want to say things like, can you tell me more about what's been hard lately? And validation really is key. Even if their feelings seem small to us, they are big to them. A simple, that sounds really tough, I understand why you feel that way, goes a long way. And the next thing is recognizing warning signs and when to seek help. So how do we know when a typical mood swing becomes something more concerning? While every child experiences sadness, stress, or frustration at times, there are warning signs that indicate deeper struggles. So, some signs that your child may need professional support. One is persistent sadness or withdrawal that lasts more than 2 weeks. Another is sudden changes in behavior, like anger, isolation, and decline in school performance. And physical symptoms of stress, like headaches, stomach aches, trouble sleeping. And then self-harm or talk of suicide. Even casually or in jokes, always take it seriously. Also, increased risky behaviors, such as substance use, dangerous online activity, and reckless actions. If you notice these signs, don't wait. Trust your instincts and seek professional help. Early intervention makes a huge difference. And finally, addressing stigma and normalizing mental health conversations. One of the biggest barriers to kids getting help is stigma, the fear of being judged or seen as weak for struggling with mental health. We need to change that narrative. We want to normalize therapy as self-care, not weakness. Just like we see a doctor for physical health, therapy helps with emotional health. You can say things like talking to a therapist is like having a coach for your mind. We want to correct harmful myths. So if a child hears people say things like therapy is for crazy people or just tough it out, you want to correct those things when, if you have family members or friends saying those things, and mention actually a lot of strong, successful people go to therapy to take care of their mental health. You can share personal or public examples. If you've gone to therapy, sharing that can encourage your child. Or use well-known figures like some athletes and musicians and influencers that openly talk about mental health. At the end of the day, what kids need most is to know that they are not alone. They don't expect us to have all the answers, but they do need us to listen, validate, and support them. And if they need mental health professional support, that's okay. Seeking therapy is a sign of strength, not failure. The earlier we address mental health struggles, the better outcomes for our kids. Next, we'll talk about available mental health resources and how to connect your child with the right level of support. Understanding that your child needs mental health support is one thing. Figuring out where to go and how to access the right service is another challenge altogether. Many parents feel overwhelmed by the mental health system and are unsure of what level of care is best, what insurance will cover, and how to advocate for their child. So in this section, we'll break down the process into clear, actionable steps to help you get the right support for your child. So first, we're going to determine the appropriate level of care, that will support your child's needs. There are different levels of care, and choosing the right one depends on the severity of the symptoms and the impact on daily life. So we discussed this, but to recap, levels of care are outpatient therapy for mild to moderate needs. They could be weekly or biweekly sessions. It could be individual, group, or family therapy. It could be best for managing mild anxiety, depression, or behavioral issues, and it could be virtual or in person. An IOP or intensive outpatient program is more for moderate to severe needs. These kids are coming 3 days a week, a few hours per day. It's a more structured setting than traditional therapy, and it focuses on skill building and emotional regulation. It often includes group therapy, psychiatric support, individual sessions, and sometimes family sessions as well. And the next level of care is partial hospitalization program, or PHP. This is for severe struggles and but not requiring an inpatient stay. So these are kids coming 5 days a week, similar to a school day schedule. It's best for those struggling with daily functioning, but again, not needing 24/7 supervision. Includes therapy, psychiatric care, skill building, group and individual sessions as well. And then there's inpatient and residential treatment, which is for crisis and high-risk needs. So this is 24/7 care in a hospital or residential setting. It's necessary for those at risk of harming themselves or others. It is a short-term stabilization with discharge planning for continued care. So if you're unsure what level of care your child needs, you're going to start with an evaluation from a mental health provider. So many outpatient therapists can help assess whether a level of care is necessary. Innerspace counseling, when you call us and inquire about treatment, the first thing we do is just take basic demographic and insurance information that gets forwarded to a clinician who contacts you, speaks to your child, and assesses if our programs would be a good fit. Whether or not we're a good fit, we're letting you know the level of care that we recommend. And if we're not a good fit, we'll also give you referrals. One of the lovely things about the mental health community in New Jersey is I have found that people are very helpful, and if they can't help you or feel that they're a good fit, they will connect you with someone who is. So the next part is insurance considerations and financial assistance options. So once you determine the appropriate level of care, the next step is figuring out how to pay for it. So insurance coverage can be confusing, but understanding some basics can make the process smoother. So the first step is knowing your insurance plan. Check if the provider you're interested in is in network with your insurance. Innerspace counseling, for example, is in network with commercial insurance plans. Understand what your coverage is. What are your copays? What is your deductible? What are your out-of-pocket maximums? So you want to call your insurance provider for those details. And if you don't have insurance or you need financial help, I would recommend you look into New Jersey Family Care, which is New Jersey's Medicaid program. New Jersey Family Care does cover mental health services. There are also some clinics that offer sliding scale, where some therapists adjust their fees based on income. There are state-funded programs such as mobile response teams or crisis services and community mental health centers that offer free or low-cost care. There are also school-based services. So many schools now have in-house counselors, or they have partnerships with mental health providers that actually come into the school. So if you're struggling to afford care, don't hesitate to ask providers about financial assistance options. Many organizations have resources to help families access care, or at least can connect you with services to help. And the next thing is, key providers and facilities in New Jersey. We do have a range of mental health resources, from local therapists to specialized treatment programs. So some key providers and services available are, private therapy practices and counseling centers that do individual and family therapy through in-person or telehealth. Innerspace Counseling provides the IOP and PHP programs for kids who are struggling with anxiety, depression, school refusal, OCD, emotional regulation. And we're in network with major commercial insurance plans as well. There are also crisis and emergency services. So Perform Care New Jersey, the phone number is 877-652-7624. It is a 24/7 access for children in crisis, and they have mobile response teams that can dispatch and come out to your home and really help in those crisis moments. And there are also the hospital-based mental health programs. So you can always go to your local ER, RWJ, Hackensack Meridian, Princeton House, Carrier Clinic. They often offer, a lot of them offer not just the inpatient, but also offer IOP and partial care. And again, if you feel it's an emergency and you're very concerned for safety, I highly recommend you go to your local ER for that assessment. And then school-based services. So many schools offer on-site counselors, child study teams, and mental health partnerships. There are also IEP and 504 plans that can include mental health accommodations. So if you're unsure where to start, a pediatrician, a school counselor, or a therapist can help guide you in the right direction. And the next part really is advocating for your child's mental health needs in schools and communities. Accessing care is just part of the journey. Parents also need to advocate for their child's needs in schools, healthcare settings, and in the community. Advocacy ensures that children receive the support they need at home, in school, and in treatment. So, advocating in schools. You should request a school counselor or child study team meeting if mental health is affecting their academics. You should explore IEP or 504 plans, which are accommodations such as extended test time or emotional support services. And encourage schools to have more mental health education, and that would help reduce some stigma too. And as far as speaking up in mental health settings, ask providers questions about treatment plans, medication, and therapy options. Request a second opinion if a diagnosis or a treatment doesn't feel right. Building a support network. Connect with other parents that are navigating similar challenges. Join local or online groups for guidance and encouragement. And get involved in mental health advocacy organizations to push for better access and policies. Remember that you are your child's best advocate. If something doesn't feel right, whether in a school, a doctor's office, or a treatment center, trust your instincts and speak up. Navigating the system with confidence is so important. So while navigating the mental health system can feel overwhelming, the key is taking it step by step. Start by assessing your child's needs, explore the right level of care, understand your insurance options, and don't be afraid to advocate for your child's well-being. If you have questions or need help finding the right resources, please reach out. You are not alone in this journey. There is support available, and together we can ensure our children get the care that they deserve. As we wrap up our discussion, I just want to take a moment to acknowledge you. Finding this webinar and sitting through it, it really shows your commitment to your child's well-being, and you're taking an important step in gaining knowledge and tools that will support your child in meaningful ways. So the key takeaways to this presentation are: one, that youth mental health challenges are real, they're growing, but with awareness and early intervention, we can make a difference. That open and honest conversations with your child about their feelings can foster trust and resilience. That there are different levels of mental health care, and knowing when and how to access them is crucial. And advocacy is key, and help is available. You don't have to navigate this alone. But above all, remember that supporting your child's mental health is a journey, not a destination. There will be challenges along the way, but with patience, compassion, and the right resources, you can help your child thrive. If you have questions or need guidance, please don't hesitate to reach out. We're here to help connect you with the right support. Take what you've learned today and start the conversation with your child, with your family, or with your child's school. And stay connected. Building a community of support is one of the most powerful things we can do for our children. Thank you for joining, for showing up for your child, and for being part of the movement to prioritize youth mental health. Your role as parent and advocate is invaluable, and together we can create a future where mental health is openly discussed, supported, and prioritized. If you'd like additional resources or have questions, I'm available. Our contact information for Innerspace counseling is here. We are happy to conduct screenings to help assess what level of care may be best for your child if you're having concerns. Innerspace counseling is located in Old Bridge, New Jersey. We have a blog on the website that posts lots of information on different mental health topics that may be useful. And I am available, my cell phone, my email. Feel free to reach out. I hope to talk to you soon. Thanks.